Good day, everyone. Welcome to our rationalization for long test 1 for nursing learning outcomes appraisal 1. And I'm actually in charge of discussing two specific items. And our focus this long test 1 is on the nursing practice 1, or the care of individuals, families, population groups, and community. And this is actually under the subject community health nursing when we're actually in your level 2 and level 3. And I have been assigned to have this 8.1 fundamental concepts of community health nursing, and the other one is 8.7. Let's begin with the first situation. Public health nursing is a specialized form of registered nursing that combines nursing and public health principles. It is concerned with threats to the overall health of a community based on population health analysis. Question number 1. Which of the following station definitions is properly matched? Letter A, American Nurses Association, community health nursing is a synthesis of nursing practice and public health applied to promoting and preserving the health of the population. Letter B, Freeman Public Health Nursing synthesizes the body of knowledge from the public health sciences and professional nursing theories for the purpose of improving the entire health of the entire improving the health of the entire community. Or letter C, American Public Health Association, public health nursing may be defined as a field of professional practice in nursing and public health nursing in which technical nursing, interpersonal, analytical, and organizational skills are applied to problems of health as they affect the community. Or letter D, all of the above are correct. Of course, we know that when we are talking about the definition of public health nursing, it has to be a definition that is highlighting the importance of community health nursing in the community setup. So in this case, we will eliminate letter B and C because that was actually an interchange definition. So Freeman defines public health nursing may be defined as field of professional practice in nursing and in public health, while American Public Health Association defines public health nursing synthesizes the body of knowledge from public health sciences. So the best answer for number 1 is letter A. That is American Nurses Association. Community health nursing is a synthesis of nursing practice and public health applied to promoting and preserving the health of the population. So this is the best definition in which it's actually coming from the American Nurses Association. So that is actually a definition that uh, was actually defined in 1980s. And of course, they said that community health nursing is a synthesis of nursing practice and public health applied to promote and at the same time preserve the population health. And that is actually wording echoed in a standard of community health nursing texts. So number 1, the answer is letter A. Number 2. According to C.E. Winslow, which of the following is the goal of public health? So we're talking about the goal of public health. Letter A, for people to attain their birth rights and longevity. Letter B, for the promotion of health and prevention of diseases. Letter C, for people to have access to basic health services. Letter D, for people to be organized in their health efforts. Of course, we know that C.E. Winslow is one of the father of public health, and the focus of C.E. Winslow is basically on making sure that the people will actually achieve birth rights and at the same time longevity. And this was actually a classical definition of C.E. Winslow since 1920 that ensures that each citizen can actually realize his individual birth rights and longevity. But when you say promotion of health and prevention of diseases, that is actually the goal of community health nursing. And for people to have access to basic health services, that is on primary health nursing. Then for people to be organized in their health efforts, that is specifically uh, more of COPAR setup. Number 2, the best answer is letter A. Number 3, according to Margaret Shetland, the philosophy of public health nursing is based on which of the following? A, health and longevity as birthrights. B, the mandate of the state to protect the birthright of its citizen. Letter C, public health nursing as a specialized field of nursing. Or letter D, the worth and dignity of man. Of course, we know that Margaret Shetland summarizes the public health nursing's philosophy that actually grounds a practice in respect for the worth and dignity of person, which orients nurses to person and community-centered care. So in this case, the best answer is letter D, the worth and dignity of man. Of course, we know that these two individuals, C.U. Winslow and Margaret Shetland, are the most notable individuals for community health nursing. Just remember, for C.U. Winslow, the focus is on longevity and birthright. So we eliminate letter A because that is for C.U. Winslow. And if you talk about Margaret Shetland, that the focus is all about the worth and dignity of man. Answer for number three is letter D. When we say the mandate of the state to protect the birthright of its citizen, that is from the Philippine Constitution, and public health nursing as a specialized field of nursing, that is definition of what public health nursing is. Number three, the best answer is letter D. Number four, World Health Organization specified 10 determinants of health, which includes the following, except, so we're looking for a wrong answer here. Letter A, physical, environment, social status. Letter B, genetics, personal behavior, and coping skills. Letter D, gender, culture, education. Or letter D, optimal level functioning and social support. Of course, we know that the World Health Organization actually has a list of determinants that determines the health of the individual, and that includes income. And at the same time, social status. We also have education, physical environment. We have employment, social support networks, genetics, personal behavior, and at the same time coping skills. We have health services, gender, and culture. On the other hand, what is wrong here is the optimum level of functioning, because that is considered to be the outcome of community health nursing, and at the same time the outcome of public health nursing. So number four, the best answer here is letter D, optimum level of functioning. Social support is part, but of course, what makes the statement wrong is the optimum level of functioning. Answer for number four is letter D. Let's proceed to question number five. What approach refers to the early recognition of risk factors associated with adverse or undesirable and unwanted outcomes in clients, and taking the necessary anticipatory or compensatory intervention measures to reduce, totally eliminate, or correct or cope with the probability of occurrence of unwanted outcome? Is it A, ecologic model approach, letter B, health illness continuum, letter C, nursing process, or letter D, risk approach to healthcare? Of course, when we if you don't know the answer of this question, let's go back to the stem of the question. The question is actually on risk factors. No? So when we talk about ecologic model approach, that is all about the environment. So it was not actually specified that that talks about risk factors. And then health illness continuum, that is actually a figure that actually defines the the continuum of health towards illness and from illness towards health. And letter C, nursing process, is actually the blueprint of care to our patient. But what is asked here is all about the risk factors. Therefore, the best answer for number five is risk approach to healthcare, because risk approach to healthcare is actually one of the important requirement of the World Health Organization, because it's actually a form of managerial strategy that identifies higher risk individuals, including the community, as early, and of course, it usually gives us a target for our resources and referral in order to reduce the adverse outcomes, exactly what the STEM describes. Because, of course, the STEM describes is all about risk factor. So number five, the best answer is risk approach to healthcare. Just remember, keyword in answering questions, if there are specific words that is actually from the stem of the question that is actually repeated in the choices, that's the best answer. Number five, the correct answer is letter D. Let's proceed to question number. Let's have the next situation. The World Health Organization defines a state of complete physical, mental, and social wellness, and not merely the absence of disease or infirmity. The modern concept of health refers to optimal level of functioning of individuals, families, and community. There are several factors in the ecosystem which affect this level of functioning. Question number six. The World Health Organization defines community health nursing as one of the following. Is it A, teamwork based in social and natural sciences. Letter B, assessment of clients' health needs. Letter C, achievement of human potentials. Or letter D, special field in nursing, including social assistance. Of course, when we talked about this question, it is very important that we focus on the definition coming from the World Health Organization, because we know that the World Health Organization's expert reports that it actually describes that public health nursing or community health nursing is actually a specialized field of nursing and public health, and there is actually notable historical activities, and that include social assistance alongside with health services. So in this case, the best answer for number six is letter D. Letter A, teamwork based in social and natural sciences. We know that we talk about social activities such as COPAR, but for natural sciences, that is actually not the focus this time, because that community health nursing is a specialized field of the nursing profession. In assessment of clients' health needs, that is actually the definition of uh, part of the primary healthcare, and achievement of human potentials, that is actually the goal of establishing and organizing COPAR in the community. Number six, the best answer is letter D, specialized field in nursing, including social assistance. Number seven, the primary group focus of community health nursing practice, especially in terms of maintaining the people's optimum level of functioning, is A, health promotion, B, prevention of communicable disease, letter C, reduction of lifestyle diseases, or letter D, rehabilitation. Remember, the question is asking for primary focus. So we know that community health nursing is actually population focused, that emphasizes the importance of health promotion and disease prevention to maintain optimal functioning across the individuals, families, and communities, and that is actually crafted starting from the Ottawa Charter framing when primary healthcare has been established. So in this case, all of is actually achieved because the focus is all about primary prevention as well. And we know that primary prevention is achieved through health education, and that health education activities are actually part of health promotion. The best answer for number seven is letter A, because prevention of communicable disease, reduction of lifestyle diseases are actually two word or two options that has of the same terms, that is communicable disease and lifestyle diseases. That's part of secondary prevention, and when we say rehabilitation, that is part of your tertiary prevention. So what is asked here is part of the primary prevention, and that is focus on health promotion activities that includes health education classes. Number seven, alpha. Number eight, the diseases today, which are largely man-made, such as poor sanitation, poor garbage collection, air pollution, smoking, and utilization of chemicals and pesticides, refers to A, political, B, behavior, C, healthcare delivery system, or letter D, environment. Of course, we know that this poor sanitation, poor garbage collection, air pollution, smoking, utilization of chemicals, and pesticides are actually considered to be man-made diseases, and that is related to sanitation, pollution, and at the same time, smoking, chemical, pesticides. And we know that the World Health Organization classifies unsafe water, unsafe sanitation, air pollution, hazardous chemicals as environmental risk, and that drive major diseases and that burdens uh, the community. And if there will be presence of tobacco exposure, it's also an environmental behavioral risk that is frequently addressed via environmental health politics. But in this case, the best answer for number eight is actually letter D, environmental, because what is highlighted is actually poor sanitation. Okay, so but of course, when we say it's actually about smoking, it can be part of political, but again, that could possibly be a part of environmental policies. Number eight, the answer is letter D. Number nine, one of the several factors in the ecosystem which affect level of functioning that include oppression, people empowerment, increase of crimes and lack of safety in streets and even the homes, which are major concerns. A. Socioeconomic. B. Environmental. C. Heredity. Or D. Political. Of course, we know that if that is about ecosystem factors that includes oppression, empowerment, crime, lack of safety, that reflects political determinants of health. Because when you talk about political determinants of health, that includes policies, power, and governance that shapes safety, that promotes justice, and at the same time, resource distribution. That is actually part of uh, the public health scholarship as promoted by the World Health Organization. So in this case, the best answer is actually political, not heredity. Uh, it might as well include environment, but of course, there's a need for us to include the politics here because that is also highlighting oppression and people empowerment. Number nine is letter D, political. Number 10. All of the following statements on community health services are true, except letter A. Rehabilitation seeks to reduce disability and, if possible, restores function. Letter B. Research systematically explores the effects of community health and practice through scientific investigations and epidemiology. Letter C. Prevention focuses on the illness end of the wellness illness continuum. Letter D. Evaluation analyzes judges evaluates and improves community health practice according to established goals and standards. Of course, what are we going to be looking here is actually a wrong answer. So of course we know that uh, prevention that is actually part of the primary, secondary, or tertiary prevention. These are activities designed to maintain or move towards wellness and avert progression to illness. And of course, the focus should not be on the illness end. So the best answer for number 10 is letter C. Letter A is correct. Rehabilitation seeks to reduce disability. That is part of the tertiary prevention because you're talking about rehabilitation. Letter B, research systematically explores the effects of community health and practice through scientific investigation and epidemiology. That is part of uh, epidemiological investigation. And letter D, that's part as well of establishing quality control. So the best answer for number 10 is letter C because we're moving to the wellness continuum, not on the illness one. 10 is letter C. 11. Public health services are given free of charge. Is this statement true or false? A. The statement is true. It is responsibility of the government to provide health services. B. The statement is false. People pay indirectly for public health services. C. The statement may be true or false depending on the specific service required. Or letter D. The statement may be true or false depending on the policies of the government concerned. Of course, C and D is eliminated because you have to stand on a correct answer. So, of course, in the Philippines, many public health services are free at point of care, but they are actually financed by taxes and insurance that is covered by the PhilHealth, and that is actually under the Universal Healthcare Act, which is actually RA 11223. Therefore, they are not considered to be free in absolute terms. The best answer for number 11 is it's false because people pay indirectly for public health services, and that is through the taxes that we pay uh, to our government. 12, letter B. That's 11. 11, letter B. 12. The first contact of patient in the health center is the. Of course, we know that in the health center, there are actually individuals present. So letter A, it's midwife, B, nurse, C, auxiliary health worker, or D, physician. Of course, these midwife and auxiliary health workers are usually not in the health center because they conduct home visit. They are actually the contact of the people in the community but not in the health center because in the conduct of the home visit the midwife is actually assisted by the auxiliary health worker or basically the barangay health workers, and they are now going to be referred to the health center. So if these individuals are of these people are being referred to the health center. So therefore, the first contact in the health center is actually the nurse, because they have been visited by the barangay health workers, and at the same time the midwife at their home households. So that is when there is presence of referral already to the health center, and that is the first contact is actually the nurse. So the best answer is B. Let's proceed now to ACE 8.7, that is nursing process in the care of community. And we have 13 questions for this. Let's begin with question number 75. This is until 83. Nurse A is assigned a barangay health station, Barangay A, where residents frequently experience diarrhea outbreaks due to the recent typhoon. Which of the following is the most essential initial assessment? Is it A, Nurse A identified the most common type of diarrhea among residents? B, Nurse A assessed the water sources, sanitation facilities of households. Letter C, review barangay health records for mortality status or statistics. Letter D, conduct stool specimen examination in selected households. Of course, the focus of um, the question is basically on assessment, initial assessment. So it is very important that community assessment starts with environmental and social determinants, and that is actually tied to the problem uh, rather than immediate diagnostics. So, of course, the most important thing that we're going to look into here is post typhoon diarrhea outbreaks. That's why we have to assess the water sources and sanitation facilities of the households. And of course, it is emphasized by Formorca that community diagnosis begins with identifying environmental and social determinants, and of course, in this scenario, there's presence of unsafe water and sanitation, which are actually the likely causes of the condition. So assessing these factors are more critical than focusing only on disease type of or specific lab tests. So number 75, the best answer is letter B. Because on letter A, most common type of diarrhea that is done after the assessment. Then we talk about letter C, review of records. So that is done once you have actually identified the sources of water. And then after that, after the assessment, then you proceed with stool specimen collection. Number 75 is B. 76. Nurse B recently conducted a survey in his assigned barangay health station. He discovers that 60% of the households have stagnant water around homes. Which type of data is this? Is it subjective, objective, secondary data, or inferential? Of course, wrong na diretso ang letter D. Because when you say inferential, it means that you talk about statistics. So secondary is also wrong. It's because that is focused on secondary data coming from sources like library or like books, that's journal. So in this case, the best answer for number 76 is letter B, that is objective. That's actually an objective data. So that's considered to be a direct observation. That's seeing stagnant water, and if, of course, when you talk about interviews now, then that could possibly be subjective. And if that is existing records, that is part of the secondary data. So in this case, if there will be presence of direct observation of stagnant water, that's as what I mentioned, that is objective. And of course, for Morka notes that assessment should integrate primary data, that is direct observation, from the source of the information. So number 76 is letter B. 77. Nurse C received a rural community report that showed a high prevalence of acute respiratory infections, or ARI, in children under 5, overcrowded homes, and high smoking prevalence among adults. What is the most appropriate community nursing diagnosis that Nurse C should formulate from this existing data? Letter A, risk for infection related to poor hygiene practices. Risk for ARI related to overcrowding and exposure to smoke. Letter C, ineffective health maintenance related to low parental knowledge. Or letter D, deficient community resources related to lack of health services. Of course, in this question, we are talking about nursing diagnosis. So, of course, we know that acute respiratory infection is actually for less than 5 years old, is considered to be one of the thing that we are going to look into for individuals in the community. So, sound nursing diagnosis usually links a problem or risk to etiologic factors that is actually present in the data, such as the crowding, secondhand smoke, and that's actually consistent with NANDA guidance on diagnostic statements. And the correct answer for number 77 is letter B. So, of course, that's according to Formorca. Community diagnoses are actually linking health problems with causative factors, and the data directly point to ARI risk from overcrowding and smoking exposure. So letter A is actually not specific because you talk about poor hygiene. Letter C is also not specific because you talk about parental knowledge. And letter D is not the focus of what is being asked because that is all about community resources. 77, letter B, risk for acute respiratory infections related to overcrowding and exposure to smoke. 78. Nurse D identifies three problems in a community: high malnutrition rates among preschoolers, low immunization coverage of 40%, presence of an increasing number of hypertensive adults. Which problem should be given the highest priority by Nurse D and must be given intervention immediately? Is it A, malnutrition among preschoolers, B, low immunization coverage, letter C, hypertension in adults, or letter D, all equally prioritized? Of course, we know that uh, we need to check on priority setting framework that includes the magnitude, including the severity, in feasibility of interventions, and of course a public concern. So if there is actually problem with priority, so you focus on low coverage risk with outbreaks with rapid severe impact, and at the same time prevention is highly feasible, and of course it can be effective compared with specific uh, other specific problems. So in this case, the best answer for number 78 is actually letter B, because of course according to Formorca, that applies with the prioritization framework. And of course, immunization gaps can lead to outbreaks that might actually be uh, severe and impactful to the community. So the best answer is letter B. Then after the low immunization coverage, next priority is malnutrition among preschoolers, and then third priority is hypertension in adults. Because of course the other two problem requires longitudinal management. 78. The best answer is letter B. Let's proceed now to 79. After community diagnosis presentation in community E, Nurse E is now drafting objectives. Each of the following objective is SMART compliant. A. Improve health status of families in Barangay E. Increase knowledge of mothers regarding nutrition. Letter D. Decrease incidence of dengue by 20% within 6 months through environmental sanitation. Letter D. Encourage residents to participate in waste disposal activities. Of course, we know that if that is SMART compliant, of course, that should be SMART specific, measurable, uh, attainable, realistic, and time bounded. So in this case, what is very much measurable here is letter C. That's only letter C. The best answer for number 79 is letter C, because there is this target that is 20%, and the time frame is 6 months, and the strategy is about environmental sanitation. So that meets the criteria of SMART. So number 79 is letter C. 80. Nurse F is preparing his blueprint of care in the community. Which of the following is the best goal statement for Barangay F with high cases of pulmonary tuberculosis? A. Residents will maintain optimal lung function. Letter B. The community will reduce TB prevalence through early detection and treatment adherence. Letter C. Patients will not develop drug resistance. Or letter D. Families will prevent spread of TB to children. Of course, from the question, uh, best goal. So if you're talking about the best goal, it should be letter B. That is, community will reduce TB prevalence through early detection and treatment adherence, because according to community health nursing, our goal is to focus on the population, not just the individual. Okay, and let this option is actually a reflection of a population-based outcome that is consistent with Famorca's book and that emphasizes on community-centered care. So that's also very significant that uh, that is also part of the evidence-based strategies that highlights the case finding and at the same time the adherence of treatment. So letter A, residents will maintain optimal lung function that is focused on the resident but not the entire community. Then patient and families are part of the community, but of course our priority here is the barangay itself, the entire community. 80 is letter B. Let's now have 81. Nurse G plans a mass immunization campaign in his assigned barangay. Which step should come first in implementation of the nursing care plan in the community? A. Mobilize barangay health workers to assist. B. Procure vaccines from the health center. Letter C. Inform community leaders about the schedule. Or D. Conduct health education and vaccine importance. Of course, it is very important. The question is, uh, step which step should come first in implementation of the nursing care plan in the community? So, of course, if you're talking about implementation, that requires community participation and at the same time leadership involvement. So, of course, in ensuring buy-in before mobilization and resource allocation. So, what is very important here is, of course, the participation of the community. The best answer is letter C. Inform the community leaders about the schedule. Of course, that is part of the participation of the barangay, and of course that secures buy-in of barangay leadership, that precedes mobilization, at the same time supply utilization and education, that increases the uptake and trust of the project. So after that is you are going to mobilize health workers to assist, and you are going to procure vaccines from the health center and conduct health education and vaccine importance. 81 is letter C, the first step. 82. Nurse H is conducting health teaching on sanitation. The nurse facilitates group discussion unless the community identifies solution. What role is Nurse H demonstrating in the conduct of the health teaching session? Health educator, facilitator of change, advocate, or direct care provider. Of course, just have to remember always that our role in the community is facilitator. So the best answer for number 82 is facilitator of change. So as a facilitator, we have to enable the group in order to analyze problems. At the same time, we have to generate options and take ownership of their actions. And that is actually consistent with empowerment-based health promotion activities. We can be health educator, but what is another example here is if there are words that is being used in the question under the nurse facilitates, therefore we have to be facilitator. Number 82, the answer is letter B. I think this is the last number on my end. That is question number 83. Nurse I would want to evaluate the impact of nutrition program after 6 months. The mean weight for age of preschooler improved by 15%. This evaluation reflects which type? Is it letter A, process evaluation, B, impact evaluation, C, uh, outcome evaluation, or D, formative evaluation? Of course, we know not yet. I think I'm gonna end by 87. Sorry. So if that is the focus, it should be letter B. That's impact evaluation. So when you say it is process, that includes activities. And when you say it is impact, that is all about short or midterm changes. That includes knowledge, behavior, and at the same time health indicators, and that is part of the growth. Then for the outcome evaluation, that is long term, probably you focused on presence of mortality. And then if that is part of the impact, so that is part of weight gain that is present in 6 months. So formative evaluation, that is specific for uh, school evaluation. So number 83, the best answer is letter B, impact evaluation. Again, for process, that talks about activities. For impact, that is for short and mid changes. Then of course outcome is long term. but formative that is school based. 84. In barangay meeting conducted by Nurse J, residents resist a proposed waste segregation project, saying it's too time consuming. What should be Nurse J's best action? A. Implement the project since it is mandated by the law. Modify the plan with input from the residents. Conduct house monitoring to enforce compliance. Or letter D. Seek the mayor's assistance for enforcement. Of course, letter A is immediately wrong, and letter C is also going to be wrong because enforcing and mandated the law is actually very autocratic in nature. We know that community health nursing follows partnership and people's participation, and that's actually one of an indicator for adaptability to community readiness, and that improves the acceptability and sustainability of the project. So, what is the best answer for number 84 here is modify the plan with input from the residents. That is actually more of democratic in nature, that will be allowing them to take part of the decision making process. Number 84, modify. 85. Nurse K reads recent research on using mobile health apps for monitoring BP as technology advancement. Which step of the nursing process is most aligned with? Is it assessment? Is it planning? C. Implementation? Or D. Evaluation? Of course, applying research evidence into practice aligns with the implementation part. And of course, FAMORCA supports evidence based interventions in community health nursing. Therefore, that is part of implementation. That is evidence based with in planning and applying the app in practice. That is implementation. 85, letter C. Last two numbers. Nurse L conducted a survey in Barangay L. A mother refuses to answer sensitive questions about family planning. Which of the following should Nurse L do to address the concern? Letter A, skip the question and proceed respectfully. B, persuade her, explaining the importance of the data. C, report her refusal to the barangay captain. Or D, exclude the family from the program. Of course, when we are talking about confident or sensitive questions, FOMARCA usually stresses that we need to respect for autonomy and at the same time voluntary participation. So refusal must be respected, and that should actually prevent then coercion or punitive actions. So therefore, the answer for number 86 is skip the question and proceed respectfully. Let it be persuade her, explaining the importance of the data. That's all. That's more or less not providing anymore the autonomy. Reporting is autocratic in nature, and excluding is actually a sense of injustice. Number 86, the answer alpha. 87, I think this is the last number. Nurse L identifies the lack of potable water contributes to repeated diarrheal outbreaks in Barangay L. She coordinates with the municipal engineer for deep well installation. This reflects which principle utilized by Nurse L. A. Curative care. Or curative care focus. Letter B. Intersectoral collaboration. Letter C. Selective healthcare delivery. Letter D. Specific disease specific approach. For this number, the best answer is actually letter B, intersectoral collaboration. So, of course, FAMORCA emphasizes that health is a multi-sectoral approach and it requires collaboration with non-health sectors, and it includes the engineering department, education, and at the same time, your agriculture. So, intersectoral action is a core of primary health care principle. So, the best answer is letter B. So I think that is it. Congratulations, everybody, and see you again next time. This has been Joseph Abang signing off. Thank you, everyone.